I've heard you can use filler to fill in the black triangles in your mouth. Is this true, and do you recommend this? We're going to give this question to board-certified cosmetic dentist Dr. Joe Willardsen, joining us now via Skype. Doc, what say you? Because when it comes to these quote-unquote black triangles, what causes them, and is this a potential solution?
Well, you know, the gums are prone to losing volume over time. So whether it's from periodontal disease or maybe the teeth are moving or other problems, you get that little triangle, and you know, it becomes kind of a problem aesthetically. It's more of a cosmetic problem than anything.
We know part of the aging process, we're losing volume pretty much everywhere, and so you're totally on board the filler wagon, the Botox wagon. The people come in, they don't like their smile. You look at how gummy is that smile, and do I have parts of the gums that are receding? So you've got options that you can do to help those areas, correct, Joe?
Exactly. So I kind of use the black pepper test. If it looks like you have a piece of black pepper stuck between your teeth, that's about the size of the area that can be treated. And so the dermal fillers are good for kind of filling that in. But you have to remember that any type of dermal filler is going to resorb over time, and it's going to be one of those things you have to do over and over again to keep that, that space closed.
How often would you have to redo that once you start the treatments? You know
what? I've seen it work from anywhere from 4 months all the way up to 8 or 9 months. So it just kind of depends on the patient, but that's that black pepper area. So it looks like maybe there's something stuck between your teeth, and patients hate it. You know, they're always looking for a solution.
What if I have a green broccoli area?
Floss.
Okay. I hate flossing.
If you've got a green, you need to use the fuzzy end of the brush.
Yes, you do. And Joe, what would be the contraindications to doing this?
Well, if you have any periodontal disease, that's certainly not something that you want to mask or hide. I would say that's the biggest contraindication, is trying to mask a bigger problem.
And I know costs will vary, but about how much does this cost on the low end of things?
I would say about $100 a site.
Yeah, because you're using a very small amount, as Dr. Willardsen said. These are micro injections. You don't want to over-inject ever, anywhere, but particularly in the gum.
But I think a really valid point, and thank you for that, Dr. Willardsen, which is if you have true periodontal disease, receding gum line, this is purely a cosmetic solution, so this would not be your go-to.